A solution is said to be dash when it contains a lower solute concentration than the cell. A. Hypotonic. B. Nontonic. C. Hypertonic. D. Isotonic. The answer is A. Hypotonic. A hypotonic solution is one that contains solutes at a lower concentration than the cell. A cell, such as a red blood cell, will swell when exposed to a hypotonic solution as water moves into the cell to balance the osmotic gradient. Which vitamins are necessary to convert glutamic acid into glutamine? A. Vitamin E and vitamin D. B. Vitamin C and vitamin B12. C. Vitamin B3 and vitamin B6. D. Biotin and folate. The answer is C. Vitamin B3 and vitamin B6. Vitamin B3 and vitamin B6 are required to convert glutamic acid into glutamine. Biotin, vitamin B7, plays roles in fat and amino acid metabolism, and though there has been no conclusive evidence of its effect on the growth of hair and nails, it is commonly taken as a supplement for these purposes. Folate, vitamin B9, is required during synthesis of red blood cells, and during DNA replication. Folate cannot be synthesized in ovo, and thus must be ingested from the diet. Vitamin C is a powerful antioxidant, and is a cofactor to many biological processes. Cobalamin, vitamin B12, is involved in cell metabolism, particularly in that of fatty acids and amino acids. The source of B12 is from the natural flora of the gut. Vitamin D enhances the absorption of minerals such as calcium, magnesium, and zinc from the gastrointestinal tract. Vitamin E is a fat-soluble antioxidant. What B vitamin deficiency is common in alcoholism? A. Folate. B. Riboflavin, B2. C. Biotin. D. Thiamine, B1. The answer is D. Thiamine, B1. Alcoholism is associated with thiamine, vitamin B1, deficiency. This is due to multiple factors: poor nutrition, ethanol's inhibition of thiamine transport in the intestine, and reduced storage of thiamine in the liver due to fatty changes. What essential amino acid is a precursor to nitric oxide? A. Leucine. B. Methionine. C. L-arginine. D. Histidine. The answer is C. L-arginine. L-arginine is a precursor for the production of nitric oxide, essential to vasodilation. Other precursors to nitric oxide include NADPH, oxygen, and nitric oxide synthetase, NOS, enzymes. These other amino acids do not have essential roles in the nitric oxide synthesis pathway. A physician might recommend decreased fluid intake for which of the following conditions? A. Vomiting. B. Renal disease. C. Pressure ulcer. D. Nasogastric tube. The answer is B. Renal disease. A physician is most likely to recommend decreased fluid intake in a patient that has renal disease, particularly if they are in any stage of renal failure. This is because a high fluid intake may put undue strain on the already impaired function of the kidney. Increased fluid intake is generally recommended for all of the other conditions listed. What is the most common cause of copper deficiency in the U.S.? A. Soil mineral depletion. B. Inadequate dietary intake. C. Wilson's disease. D. Gastric bypass. The answer is D. Gastric bypass. The most common cause of copper deficiency in the United States is gastric bypass. This is due to malabsorption from food. Copper is fairly ubiquitous in soil and in the average American diet. Wilson's disease is a disorder of excess copper, rather than copper deficiency, resulting in a variety of neurological symptoms. Which of the following is a symptom of vitamin K deficiency? A. Bone malformation. B. Petachy. C. Cartilage calcification. D. All of these. The answer is D. All of these. Vitamin K deficiency can cause a variety of issues related to inability to form blood clots such as petachy, excessive bleeding, bruising, heavy menses. This vitamin is also an important part of bone and cartilage formation, with deficiency resulting in malformation of developing bones and cartilage, or deposition of calcium into cartilage or arterial walls. Which of the following spices was shown in several studies to lower blood sugar in type 2 diabetics by decreasing insulin resistance? A. Turmeric. B. Cumin. C. Cinnamon. D. Oregano. The answer is C. Cinnamon. An intake of 1 to 6 grams of cinnamon has been shown in studies to lower blood sugar in patients with type 2 diabetes by as much as 25%, possibly due to its ability to improve insulin sensitivity. Which of the following is the most common cause of osteomalacia? A. Biotin deficiency. B. Vitamin K deficiency. C. Vitamin E deficiency. D. Vitamin D deficiency. The answer is D. All of these. Vitamin K deficiency can cause a variety of issues related to inability to form blood clots such as petachy, excessive bleeding, bruising, heavy menses. This vitamin is also an important part of bone and cartilage formation, with deficiency resulting in malformation of developing bones and cartilage, or deposition of calcium into cartilage or arterial walls. Which of the following nutrients, when consumed at the same time as a meal that contains non-Hem iron, iron from plant sources such as spinach, can significantly improve iron absorption? A. Calcium. B. Vitamin C. C. Vitamin D. D. Magnesium. The answer is B. Vitamin C. Vitamin C chelates non-Hem iron in food while exposed to the acidic pH of the stomach. This chelated iron then becomes more soluble in the alkaline pH of the duodenum, resulting in increased intestinal absorption of iron.